Hi, this is Dr. Stefan. It's Wednesday morning here in the UK, and before I went to work today, I thought I'd just go over a couple of comments that I receive on my channel, and just to show you what kind of comments I sometimes get. My channel is very small at this stage, okay, I have to say that, but obviously, comments do keep trickling in. Some videos are becoming slowly more popular. This encourages me to do more. So please, by all means, do submit your comments or your questions in the comment section below each video if you're watching my videos. And I will try to cover some of these comments in future videos or answer them directly if I can. But obviously, I'm not your doctor, so I have to say that from the very beginning. So what I'm saying to you, what I am responding, does not constitute necessarily medical advice in your case. It's basically a way for me to promote general medical information and to encourage people to go to see their doctor if they have a problem, because I think this is a huge issue in today's world when we do have access to a lot of information, but we don't have a lot of access to medical education. And there is a difference, I think, in my mind. And much of the information that you find online actually does not apply very well in your case. So that's something that only your doctor, your healthcare provider can put into the right context and provide you the appropriate diagnosis in your case. So in case you're missing something. So for example, you may not think of a question that your doctor might ask you, which could be key, could prove to be key to establishing the right diagnosis or giving you the right treatment. For example, some treatments may not be the right treatments in someone's case, even though they seem like the best revolutionary treatment in the world, but maybe someone will be better off with one of the more classical treatments, let's say, the more established treatments. So it depends on a case-by-case basis. So always, if you've got health issues, try to see your doctor as early as you can. If you stay at home and you don't see your doctor and you wait, your body might actually become more imbalanced. So usually when a condition appears in one part of the body, it tends to sort of affect other areas of the body over time. So for example, if you've got heart disease, for example, over time you might develop kidney disease as well, or eyesight problems or other issues. So it's important to go early. So that being said, and I'm sorry about rambling on, but I think it's really, really important to give you that message, to encourage you to go see your doctor, because we are not people that should be feared. I think sometimes there's a lot of misconceptions about what doctors do, and we are normal people. We have our own lives, and it's just that we have been trained in this field to try to provide advice that's tailored to you and to try to filter all the information that you're getting and try to adapt it to your case. So that's basically the art of medicine, let's say, and that's where the experience comes in. So seeing an experienced physician is usually a much better way of going about your health and getting concrete help rather than going online and reading random things. So I'm going to try and answer some of the questions that I received on the channel, generally pertaining to asthma. You'll see there's quite a lot of comments here. Let me just, if I swap over to the screen with the comments, you can see that there's, even if my channel is fairly small, there's still a lot of comments coming through, because I think a lot of people do require clarification about certain things. And I can provide clarification to some extent. I cannot answer all your queries, and you'll see that sometimes you may see patients, people online, basically they just put a 2-line comment and they expect an answer that will fix their problem. And it's not usually as easy. Medicine is not as black and white. So many people, for example, ask me, oh, I'm really, really tired when I exert myself. What could be the cause? And there can be tens of causes for that. So it's very hard for me to answer. But anyway, let me stop rambling, and I'll try to focus this video, like I said in the title, on asthma. So I'm gonna search through my comments and look for asthma. This is just my YouTube backend. So this is what I see when you post comment on the videos. They all get sort of added onto each other, and I get this sort of, it's like a report in the back end of the YouTube channel. And this is what I see. So basically these are comments that I've received regarding asthma that contain the word asthma. So this is my most recent video. I do suggest that if you have asthma, that you watch this one. I think it's a fairly comprehensive video of advice for people who have asthma. So general advice that may or may not apply in your case, but these tips may actually help you get better asthma control in collaboration with your doctor. So it's something that I would suggest watching. But I do have other questions. So let me try and cover at least a couple of them in this video. And then obviously I'll try to make some more of these if you find them useful. So do let me know if this is content that you think is useful for you. Well, let's start with the first one and let's see what this comment is about. So let's see. I get these weird feelings like an attack coming on yesterday. It was triggered by talking, but I took my rescue inhaler right away. I do smoke, but as soon as I smoked during the flare, I knew it was a bad thing to do because my asthma acted up. I now have uncontrolled asthma and I'm not sure how to deal with it as an adult. I know during major flare-ups, always use albuterol or salbutamol every 4 hours and preventative inhaler as needed. As for neb treatments, they make me so nervous. I hate using them unless I'm having a flare-up. That won't stop. Right, so this comment is covers a lot of things, and I think many patients with asthma, because asthma is like a very complex disease. So let's face it. So it's one of these conditions in which a lot of aspects of your life are affected. So for example, many people with asthma are fairly young. So they're active individuals. They have jobs, they have, a social life. They want to be part of the world, part of the society they live in. And it can be difficult if you're struggling to take inhalers, if you need to sort of take nebulizers, if you may struggle with anxiety that's related to your breathlessness. That can be, sometimes you can have an asthma attack sometimes out of the blue because, your asthma is not well controlled. You may get an asthma attack because you've just inhaled the wrong sort of dust, let's say, that contains an allergen that triggers an asthma attack, or you have a strong emotion that can trigger asthma attacks as well sometimes. So these things are difficult. They're difficult to control. So I do understand where some of these questions come from, but I think as long as you structure the information about asthma in a way that makes sense to you and you understand what the condition is, it will be a lot easier to deal with it because whatever you're doing in terms of treatment will make sense. So that's what I'm hoping through some of the videos like this one that I've posted, to try to make sense of the situation. I'm not pretending that my video will fix all your problems or that my comments, my responses to your comments will fix all your problems, but I do hope that they will at least organize the information a little bit. So about this comment, so there are quite a few things here. So let's start from the beginning. And I'm sorry, this might take a while to decompose some of these comments, but it actually takes a while to go through each bit and clarify things because there's a lot of things here that I can probably provide some opinion on. So I get these weird feelings like an attack coming on yesterday, right? Okay, so sometimes people feel that their asthma is acting up. So they have this sort of prelude to asthma attacks. This can vary from patient to patient, but it's important when you have these to try to do what this person did, to try to take the rescue inhaler right away. Now, the rescue inhaler is the inhaler that you take as needed. So that means that you take a puff of this inhaler, it usually opens up the airways a little bit. That's what it does. It doesn't control the asthma though, but it can prevent you getting a full-blown attack. Now, this is a good thing. However, there's some more things around here that I need to clarify. So this person is telling me that basically they do smoke. Now, smoking in asthma, I have said this before, is a very bad idea because asthma, if you understand what asthma is, it will make sense why smoking is a bad thing. So smoking is a bad thing in asthma because it causes irritation in the airways. Imagine if you're inhaling, okay, let's say you're having a barbecue, right? And there's smoke coming into your eyes and it hurts, it doesn't feel right. Imagine if you're constantly inhaling smoke during the day, smoking cigarette after cigarette, you're inhaling smoke that causes irritation in the airways. And asthma is an inflammatory disease that also causes irritation in the airways. So both of them lead to more inflammation. And if you have more inflammation in the airways, you'll get more asthma attacks. It's fairly simple as a concept. Now I know smoking is very hard to quit. So this is one of these things where actually, it's hard to It's hard to stop smoking, but smoking makes you feel unwell. So obviously, many people understand that. And actually, there has been research into this. And many smokers, the majority of them, actually want to quit. But it's very hard to do so. But I think in asthma, if you have asthma, your body is telling you that it's time to do something about your health. It's time to do something about the smoking. It's time to quit. Because it's just going to lead to more irritation that will lead to asthma attacks. Now, I now have uncontrolled asthma. Now, uncontrolled asthma generally means that you're having more than 2 asthma attacks per week, let's say. So 2 asthma attacks per week during the day. So you can also deem asthma as uncontrolled if you're having asthma attacks in the night, because that's when there's a suggestion that there's a lot of inflammation in the airways. So having uncontrolled asthma leads to a lot of attacks. Now, to control the asthma, you need to control the inflammation. And there are a couple of things here in the ending of this comment that make me unsure whether this person who posted the comment really understands their condition very well. So they mentioned something about taking the preventative inhaler as needed. That's not really correct. So the preventative inhaler should be taken regularly, because you're taking that inhaler to control the inflammation in the airways. So this is usually a corticosteroid inhaler. It's a low dose of corticosteroids. It doesn't usually get absorbed in the rest of the body because it's so low. But it does control the inflammation in the airways. If you control the inflammation in the airways, you control the onset of these asthma attacks. So taking this regularly is actually more important than using the reliever inhaler or the rescue inhaler regularly. So yes, during a major flare-up, you would use the rescue inhaler a lot. That makes sense because you're trying to breathe, you're trying to open up the airways. But that particular controller, like albuterol or salbutamol, it's the same thing, it doesn't control the inflammation. It just opens up the airways, acts for about 4 hours, and then that's it. So obviously, preventing the use of this inhaler is what we're trying to do. So I hope that makes sense. But let's just move on to the last bit of the question. So nebulizer treatments, they make me so nervous. I hate using them unless I'm having a flare-up. So yes, nebulizer treatments are usually also a rescue. So they're not usually treatments that control the inflammation in the long run. So I think this is really important. So having the right preventative treatment that reduces inflammation will lead to better asthma control. So you may not need the nebulizer. Now the nebulizer is just basically like albuterol in most cases. You can put some other things in the nebulizers as well. But generally you put salbutamol or albuterol or something similar to open up the airways. And you use the nebulizers because it can give you a strong dose of this medication that can cut an asthma attack. So if you're having a very strong asthma attack, sometimes when you take the nebulizer, you can cut it. But generally, you don't need to use a nebulizer all the time. So sometimes nebulizers can be used when people really struggle with their inhaler technique. But I think you should first try to learn the right inhaler technique, because the smaller devices are a lot easier to carry around. And it's a lot easier to take treatment from a small little inhaler device rather than carry around the nebulizer or use it all the time and feel like you're attached to this machine that can cause anxiety. You have to have that mask on. It doesn't feel right to most people. So I would say the nebulizer is fantastic if you're having an asthma attack and you can't really inhale the medication properly because you're breathing so fast. But otherwise, I would say that you should focus on preventing attacks. And that's by quitting smoking, removing allergens and triggers from your environment, taking a preventative medication, inhaler. And I think if these things are covered, I think you'll have a much better control of your asthma. So that's just a couple of opinions I have about this comment. And I have summarized all these in this video. So if you search for this video on my channel, I'll leave a link below in the description for you. But yeah, it might be helpful. And it's always helpful to talk to your doctor in your case to determine exactly what might improve your asthma control. And if you control your asthma, the goal should be to have a normal life or as normal as possible. So yeah, that's about this comment. Let's try to move on. Let's see. So this person has actually left a lot of comments. So thank you, Andrew, for leaving all these questions. It does help me to create this content as well. That seems relevant. So, hi Doc Stefan, I'm wondering if rib pain is common with asthma, like it feels like a body ache, like you get when you have a cold, but as soon as I take my reliever, it goes away. I mean, I'm not sure. So the thing is, pain is also a little bit of a subjective feeling. So I'm not sure if it is pain in this case, but it could be a feeling like they've mentioned the same thing here. So I get these weird feelings like an attack coming on. So I'm wondering whether this person, when they have their asthma attacks, they have something that feels like pain, but it could be just chest tightness. So when you have an asthma attack and your chest is really, really inflated with air and you can't get the air out because the airways are narrowed, it might feel like a stretch in the ribs, in the muscles between the ribs. So that may sort of feel like a body ache, but I don't know in your case. So if Andrew is listening to this, I would say, think about asking this question when you next see your doctor and see if it makes sense in your case, because I don't know. There could be other things at play that I don't know about. So obviously I can't just say over 2 lines of text what the issue is, of course. Now, another comment from Andrew. So let's see, asthmatic smoker here with allergies. I've noticed my asthma worsening just yesterday, but I was also just exposed to COVID. So I'm playing the game of asthma or COVID. Okay. During August, my asthma always gets bad, but with smoking, I usually just get chest congestion. Right. So I think this is a great comment, actually. So just thanks, Andrew, for these questions, because actually they do raise important points. So obviously, I did mention that smoking and asthma, bad idea. So that's we've covered that. Now, allergies, of course. So if you do have allergies, it's important in asthma to try to avoid the allergens that are triggering the asthma attacks, because that would lead to more allergic inflammation in the lungs, in the airways. So that's one other thing that can be done. Now here, it's important because COVID, well, everyone is, it's scared of COVID. It's on everyone's lips these days, especially this year and last year. The last few years, we've all been locked down with COVID. But COVID, at the end of the day, is a respiratory virus. So before COVID, we had influenza. We still have influenza. But there's a lot of respiratory viruses out there. Now, respiratory viruses, they do infect cells within the airways and the lungs, and they cause inflammation indirectly because the body reacts to these viruses. They try to clear the virus, so they produce inflammation. Now, that inflammation is slightly different compared to the allergic inflammation that you get in asthma. But at the end of the day, inflammation is inflammation. So it will cause similar symptoms. So it will cause this irritation in the airways, and you might get a little bit of chest tightness, breathing difficulties because you are having this inflammation in the airways. So I would say having COVID potentially can worsen asthma, and this can happen with any respiratory virus. So most people who suffer with asthma, generally after they get a chest infection, their asthma will not be as well controlled for a while. So they may need to step up their treatment for a few months, their preventative treatment for a few months, in order to control some of that inflammation that can be a little bit exaggerated in their case, especially if they've also got allergies and other things. So I think this is an important question, but obviously, if you are smoking, if you're having allergies, if you've got chest infections, something needs to give here. So you need to get rid of something, at least smoking, if you can. I know it's hard, but if you have allergies around the house, it's important to just allergens around the house. So if you're allergic, for example, to house dust mites or pollens or things like that, it's important to try to avoid these things. Now, usually this person mentions that, where did they say? During August, my asthma always gets bad. So obviously this suggests that there's something in the air in August that triggers the asthma. So it is a very important piece of information. I would write that in a diary somewhere. I would write it somewhere to be aware of that. And then maybe when August comes around, you talk to your doctor to have maybe a step up in your treatment of asthma, your preventative treatment, maybe with higher doses, a little bit more inhaler, just to keep things under control while you pass through August, and that allergen that's present, that pollen or whatever it is, diminishes and you get less of the attacks. So it's important to always sort of be aware of what your body is doing and to keep track of these things. So yeah, I think great questions, Andrew. Thanks for that. Right, let's take one more, and we're up to 19 minutes already. So I won't make this much longer. I also need to get to work. So I will make future videos about these comments. So right, Tammy, thank you. I got mine. This is about the Respimat inhaler, which is a Spiriva or Spiolto. Where is asthma mentioned here? Let's see. All right, there we go. So thank you, I got mine. This video is great. So this is a video where I was just explaining inhaler technique for some of these inhalers, like Spiriva or Spiolto. So no instructions, no information how to use this. So I had to set it all up on my own, which was not a problem, but using it I didn't know how to use it until you. Thank you. Well, thanks. I'm glad that the video was helpful. All right. Okay. So sorry, I haven't read these comments before. So sorry if my reactions are a little bit delayed. I have asthma my whole life, and I've been through every kind of inhaler, and I like this one the best, even though you said it's not mostly prescribed by doctors. I like this one the best. All right, okay. So I think this is, there's not a lot I can say here, but just, thank you for your comment. Thanks you for appreciating the fact that I've done that video, and I'm glad it was helpful. I'm really happy. I'll just put a little heart sign here. So, there is no such thing as the best inhaler. I just have to say this, because sometimes when I see these comments, I'm worried that someone will read them and think, oh, we need to take Spiriva because that will make my asthma much better. It's not the case. It depends from person to person. So some people will have a very good response to a Symbicort inhaler, for example, or a Foster inhaler. Now, I'm not advocating that one inhaler is much better than the others. It depends from one person to the next. So it's really important to talk to your healthcare providers to see which one is good for you. I don't think there's such a thing as the best inhaler. There are devices, various devices out there, and that's a great thing, because if you can imagine, some people will struggle with technique with some of the devices that have like freaky things that they need to pull down, and then they may struggle with these ones, but other people may find them very easy to use. So it depends on your preferences as well, and choosing the right device for the right patient, I think is the most important thing. So yes, Spiriva generally, which is tiotropium, is not necessarily the main treatment for asthma, so it's usually given in addition to something else. But this is just something I thought I'd clarify. Okay, shall we do one more? Okay, let's do one more question, and then I'll stop the video. So Bokika Bo, okay. So thank you very much for this excellent presentation, how to use this medicine. So this is about another inhaler called Symbicort. I'm a new member of the Allergic Asthmatics Club, okay? All right? And I'm just starting to use this inhaler. You helped me a lot. All the best greetings from Belgrade, Serbia. Okay, so I'm from Romania, so right, great stuff, neighbors. Thank you for the comment. Again, I appreciate that you are sending these comments. There's a little star for you, a little heart. So I would say, try not to, if there's one thing I can say about this comment, is just stick with the treatments that your doctor prescribed. So it doesn't matter which inhaler it is. I'm sorry you have asthma. I'm sorry you have been diagnosed with this condition. But I guess basically we just need to crack on and try to get on top of it as much as possible to have a normal life. Now, I would avoid these definitions. So Allergic Asthmatics Club, well, I don't think it's a club that anyone really wants to join. But fortunately, with good control of allergens around the house, so for example, diminishing exposure to allergens in the house, so cleaning your house quite well, making sure you know what's triggering the asthma, that can go a long way. And then, of course, avoiding smoking and, being careful around the time when pollen is high or whatever allergen is high, when you have exposure to a certain allergen, trying to avoid those periods or have better treatment during these periods will help. If you get a chest infection, to maybe increase your treatment a little bit. These are all things that can help quite a lot. So yeah, thank you for the comments. This is just an example of some of the comments that I do get and how I'm thinking about answering these questions as a doctor. But if you do have issues with your asthma, I do suggest that you go and talk to your doctor as much as possible. So thank you very much for watching this video, and let me know please if this is useful for you. And I will try to make some more of these videos in the future, because it's actually fairly easy for me to do them unscripted and unedited because it's faster. However, I don't think they're as organized as others. So if you have more questions about asthma, I do recommend watching this video that I've posted, 13 tips for people with asthma, because although it's also about a 20-minute long video, I do try to cover everything in a bit more of an organized way. So, right, thank you very much, and I wish you good health and hope to see you again in future videos. All the best. Bye-bye.